My name is Elizabeth Fowler. I'm the Acting Director of the Indian Health Service. I'm enrolled in the Comanche Nation with descendancy from the Eastern Band of Cherokee Indians as well. I would like to welcome and thank you for joining this important webinar today addressing suicide prevention in Indigenous communities. I would like to thank the National Academies of Sciences, Engineering, and Medicine for hosting this webinar. Your efforts to bring together this large dynamic group of public health researchers, subject matter experts, and advocates will have long-term positive impacts on the tribal communities we serve. I'm pleased to see there's an excellent agenda laid out for you today, filled with knowledgeable speakers who are experts on a range of health topics specific to American Indian and Alaska Native peoples. At the Indian Health Service, our mission is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. As the IHS Acting Director, I take our responsibilities to the communities we serve very seriously. We provide comprehensive primary health care and disease prevention services to approximately 2.7 million American Indians and Alaska Natives in 574 federally recognized tribes through a network of over 605 hospitals, clinics, and health stations, all or near Indian reservations. To provide this care, we strive to be aware and respectful of tribal cultures and the unique challenges each community may face. And at the IHS, we face a number of challenges in delivering health care, especially at facilities located in some of the most rural and remote locations in the country. American Indian and Alaska Native people have long experienced lower health status when compared with other Americans. To comprehend the challenge facing Native communities, it is first necessary to recognize the many factors that contribute to health disparities faced by American Indians and Alaska Natives. These include social determinants of health, such as food supplies, housing, and education, as well as the impact of colonization, historical trauma, and forced relocation that continue to resonate in tribal communities and contribute to substance abuse prevalence and worsened health outcomes. Despite the strength of American Indian and Alaska Native families and communities, suicide remains a devastating and all too frequent event. Complex interrelated factors contribute to an increased suicide risk among American Indian and Alaska Native people and include mental health disorders, substance abuse, intergenerational trauma, and community-wide issues. American Indian and Alaska Natives have the highest rates of suicide of any racial or ethnic group in the United States. Among American Indians and Alaska Natives, the suicide rate is 21.5 per 100,000, which is more than 3.5 times higher than other racial and ethnic groups. More than 1/3, or 35.7% of American Indian and Alaska Native suicides occurred among youth aged 10 to 24 years, in contrast to 11.1% of suicides among whites in the same age range. While we know that there is no one factor that causes suicide, we do know that discrimination, prejudice, stigma, and historical traumas experienced by American Indian and Alaska Native people can contribute to higher rates of suicide. Factors that protect Native youth and young adults against suicidal behavior include a sense of belonging to one's culture, a strong tribal and spiritual bond, the opportunity to discuss problems with family or friends, feeling connected to family and culture, as well as positive emotional health. The tragedy of suicide demands a proactive and coordinated response from the public sector, local and tribal communities and programs. In order to bring suicide prevention awareness and crisis services into focus within tribal nations and communities, suicide must be addressed as a public health concern that affects everyone across the U.S. and worldwide. Harnessing cultural knowledge and practices at the local level can address social determinants of health and develop structures that support mental health and health equity. Focusing on American Indian and Alaska Native areas of collaboration can include provision of services related to crisis situations by IHS facilities in rural, geographically isolated tribal communities and trust lands, supporting and developing culturally adapted suicide care and mental health services, expansion of training and services to include culturally aware and culturally appropriate services to individual tribes, partnering with urban and tribal behavioral health programs to expand crisis services, and hiring tribal members to provide representation and lived experience, and understanding the challenges facing tribal nations related to mental health, stigma, and access to services. Suicide prevention truly begins when the term suicide is not said in shame, but with empathy through the recognition of the pain both encompassed within the thought and act of suicide, as well as the outcomes related to suicide. I want to thank you again for this opportunity to provide remarks, and I look forward to hearing positive outcomes from today's forum. Thank you.